A 24-year-old footballer presents to the orthopedic clinic with the complaints of ankle pain. Your task is to examine the ankle joint. So, in today's session, we are going to see about the ankle joint as well as the foot. My name is Srinivasan. So, as with any other examination, we proceed with the usual protocols like introduce yourself, confirms patient's identity, wash your hands, explain the procedure that you are going to do the examination of the ankle and the foot, which may involve walking and making him lie down and doing a few tests to test the ankle and the foot joint and proceed on. Before proceeding, just make sure that there is no pain and confirm if the patient and has understood and if he is happy to proceed with. Expose the patient, usually the lower limb from the waist. So that's both the knee joints being exposed as well as the ankle and the foot joints being exposed. So these are the usual thing which we go about in any joint examination: look, feel, move, measure, and the special tests. So look, the most important thing is we would be looking at the with the surroundings if they are having any walking aids, and most importantly, especially in cases of foot examination and ankle examination, you need to have a look at the footwear. So we need to look whether there is any wearing or stretching of the foot of the footwear, and if there is any special adaptation which the patient has taken up to mask to get himself comfortable. Okay, so with the footwear examination should also be done and is a part of ankle and foot examination. So first, initially, if the patient is mobile, so we will ask him to stand and take a walk. So what are the things we would be observing here? We would be observing if there is any limb, if there is any instability when walking, and if there is any limited mobility. We will ask the patient to stand on the heels as well as on the tiptoes. And when the patient is standing, observe the foot and the ankle joints from the anterior, lateral, posterior, and the medial aspects and compare it with the other ankle joint. Now you can ask the patient to lie down and once again have a look into the dorsal, medial, lateral, and posterior aspects of the foot of the ankle joint, as well as the dorsal aspect of the foot and the plantar aspects of the foot. Don't forget to look in between the toes. This is one of the most important point in the foot examination. So you need to look in between the foot and the nails as well. The nails, if there is any fungal infection, if there is any trauma, okay, and you need to look into the arches of the foot as well, whether if there is any pes cavus or pes planus. Then we would be examining the skin over the ankle and the foot, whether there is any color change, as in cases of peripheral vascular diseases, whether if it's symmetrical, any scars, any wound, any calluses. So we have not seen this in any other joint. So here, because of foot, we need to look for any calluses, any corns on any sinuses which are present in the ankle and the foot joint. So these calluses, corns, it's especially for the foot examination. Then we will be looking into the deformities, any swelling, and the muscle wasting. We will be going in detail the three things, especially the pulse. So pulse examination, usually in the hip examination, we need to palpate the femoral artery, the aortic artery, the cardiovascular, peripheral vascular diseases needs to be done. Whereas in the foot examination, while performing the test itself, you can examine the dorsalis pedis as well as the posterior tibial arteries and compare it with the other side of the ankle and the foot, whether if they are normal volume and if there is any abnormality. The next one is the swelling. So you need to look for if there is any swelling near the ankle or over the tendons, which might indicate a tenosynovitis, or over the Achilles tendon, which might indicate an Achilles tendinopathy, or the 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 retroaxillar and the retrocalcaneal bursitis, which might cause swelling in the posterior aspect of the ankle joint. So these are the swelling which we need to look for in an ankle joint. And the deformity, especially in the case of foot, you need to look for hallux valgus, hamartos, clotos, malletos, pes planus, and pes clavus. So pes planus, you already know, is a flat foot, and pes clavus is an exacerbation of the arches of the foot. And now, what are these hallux, hamartos, clotos, and the malletos? Now, so here in this picture, you can see hallux valgus. So here you can see there is first metatarsal is more deviated medially, and the proximal, middle, and the interphalangeal joints, they are deviated laterally. So this is hallux valgus, and here sometimes there could be a bursa formation, and usually there will be an abnormality in the footwear which they wear. So this is hallux valgus. Look for any inflammation and redness over these regions. Here, as you can see, there is some redness over the hallux valgus. So this could be because of the footwear which he is wearing. Probably he is wearing a tight footwear, and which can cause this abnormal condition. Hallux valgus one is Malatus, Hamato, and the Clotto. So, what is the difference between these three conditions? So, here you can see in the Malato, only the distal interphalangeal joint is affected. Okay, so the distal interphalangeal joint of the toes, it's affected. In the Hamato, the proximal interphalangeal joint is affected. In Clotto, both the proximal and the distal interphalangeal joints are affected. So this is Malato, Hamato, and the Clotto. The person will complain of pain, and regarding this, if there is any one of this toe abnormality. So we should not miss to have a look into these aspects of the foot exam. Now feel. So in palpation, we will be looking in for the temperature, tenderness. So usually the tenderness with knee flexion you can examine, or you can ask the person to lie to sit and examine the ankle and the foot. So you will be looking in for any swelling or effusion, any synovial thickening, and you will be palpating the surrounding structures, the bony structures, especially the medial and the lateral malleoli, the tarsals, metatarsals, metatarsophalangeal joints, interphalangeal joints, the heel. And lastly, you will need to perform the squeeze test, so where we compress the mid foot, so that we will be squeezing the metatarsals to see if there is any pain. Okay, so the squeeze test, this is called as a squeeze test. Now, regarding the movement, we need to test the movement in the ankle joint, in the ankle, subtalar, and the mid-talar joint. So you need to hold the person's foot, the leg, and hold it with the active movement. We will ask them to perform dorsiflexion, plantar flexion, inversion, and eversion. We will do the same thing in the passive movements. So we will be holding the heel, and then we will be performing the movements, the dorsiplantar flexions, inversion, and eversion. Then we will be holding the heel and the foot, and then we will be performing the same action to look for any pain, exacerbation in pain, and we will be holding the mid talar, and then we will be asking the person to do dorsiflexion, plantar flexion, inversion, and eversion. So these are the movements which we need to perform while performing the ankle examination. The next one is the toe. The toes, we can ask the person to do flexion, extension, abduction, and adduction. So in abduction, we will be asking them to fan out the toes against resistance. We can keep a paper in between the toes and ask the person to hold it as tightly as possible. During the passive movements, make sure that you examine the foot and especially look for any crepitus. Measure. So you need to measure the calf muscles. This is the gastrocnemius and the soleus. So how to measure this? So we will be measuring 10 centimeters below the tibial tuberosity on both the legs, and look for any abnormality or muscle wasting. So that's the measurement. Lastly, the special test. For the special test, it's a Simmons test. So what we do, we ask the person to kneel on the chair, and we will give a gentle squeeze over the calf. So when we press the calf, the foot would be going into a plantar flexion. So the squeezing of the calf will lead on to the plantar flexion if the Achilles tendon is intact. In case of ruptured Achilles tendon, so this movement will be absent. Okay, so this is called as Simmons test. Finally, we need to do the other tests, especially the joint which is above the ankle joint, which is the knee, as well as the hip joint. And we will be performing the peripheral vascular diseases, cardiovascular diseases, and the neurological examination. So, this is with regard to the ankle and the foot examination. Thank you.